spent a lot of time talking about behavioral therapies with ADD and ADHD kids, and there are a ton of them. There are several books that have been written that we recommend. You know, what I preach in my office is what I call the 3 R's. And the 3 R's are routines, rules, and rewards. So we talk about whether the routines, you know, kids that have ADD or ADHD oftentimes are very reliant on their routines. They need to know that A follows B follows C. So in the morning time, for instance, they get dressed, they brush their teeth, they have breakfast. It has to be a routine. We also talk about rules, that ADHD kids tend to be fairly black and white learners in the sense that they need to know that the rule is always the rule. So that consistent parenting of limit setting and then reinforcing. And then the third component is the rewards. ADHD kids classically are very goal motivated. They're very driven by achieving a goal. It has to be a goal they enjoy or they like, but setting up those goals and those rewards, you know, can be a lot of fun for parents as well. So once those rewards are in place, they reinforce the rules and the routines. So we talk a lot about that behavioral therapy and structural changes in the home or at the school. In the school environment, parents can do or request what's called an IEP, which is an individual education plan. And what that allows for is that allows the child to, you know, get up in the middle of class and be able to stretch, walk outside the room and do a little exercise, be seated in the front of the class, oftentimes be given a special job by the teacher so that child can be kept busy. You have to recognize that kids with AD and ADHD have a lot of energy, and you can't just stifle that energy. You have to channel it or direct it and allow them to be active. Then they're happy, they're still doing something that's positive, that's proactive, and they're not disrupting the class. So there's a lot of pieces that we look at, all the way from, you know, whether or not your child may be a good candidate for medication, as well as the behavioral components and then the dietary changes. So if any of this sounds interesting to you or things that you'd like to talk about in the office, certainly I'm available for appointments. We do consultations as well as regular office visits. We can do a complete pediatric exam, including blood tests if your child needs an evaluation for anemia or thyroid conditions or anything that may be comorbid with ADD or ADHD. So we'd love for you to call and make an appointment and come in and see us.